and my background is yellow. I'm sitting on a teal seat couch, and I am a Black woman with braids in my hair, shaved on one side with a design, with lipstick on and an orange shirt. And I look forward to tonight.
Hi, I'm Leesa. My name is Leesa McClelland. I'm a white person. I have a brown shirt on, brown hair, black glasses, tattoos of a galaxy on my left arm. I have a white wall in the background. I'm in a black chair. Thank you. And Jarom?
Hi, my name is Jarom Matheson. I'm a white male, bald, with the black polo shirt on. My room here is of a tan light white wall with a wooden floor, and there is a white box lid to my right.
Awesome. This is Melissa. So the topic we're going to be discussing is something that all of us, Cookie seemed like she just went away. Her video just went away, but we'll continue with the conversation right now. I know all of us are therapists and we deal with clients and a lot of people, plus we're in therapy ourselves, right? So I wanted to start by asking, how long have you been in therapy? And were you in therapy prior to becoming a therapist?
This is Leesa. I actually did look for a therapist before I became a therapist. There was not very many therapists in Hammond, where my family lives. I couldn't find anyone in the area. My mother did look for me. My mother did go to therapy and was rather frustrated, which is why I decided to become a therapist, to be able to give back to the deaf community, because the number is quite a bit. And I did go to a therapist. I did work with a deaf therapist, and now I currently work with a hearing therapist, and there truly is no difference. And I am okay with an interpreter being present in the background of my dialogue for different issues, this time in comparison to my previous sessions.
All right, thanks, Leesa. Cookie. Thank you for joining us again, and I wanted to let you know that I did ask everyone to discuss the reasons why we're in therapy, and also if we had started therapy before we had become therapists. Leesa had just answered, so I'm going to turn it over to Jarom, and then I'll turn it over to you, Cookie.
Hi, this is Jerome signing, and I did go to a therapist for a short time in my undergrad time, and I didn't feel like a hearing therapist sat well with me. After about 5 or 6 sessions, I stopped going to that therapist, and until I became a therapist, and I realized that I definitely needed one for myself, and I got myself a therapist about 2 years ago. This therapist is hearing and can sign fluently, which was very nice.
Yes, Melissa, it is nice to have someone who could sign. So there's definitely pros and cons to having a deaf therapist versus a hearing therapist. What about you, Cookie?
And this is Cookie signing. I work with the Metro. I have been a therapist for several years. I work at the Metro School. It is really nice to have that kind of support to get through the years. It really helped me in so many different ways. It helped me become even better therapist for my students that I work with.
Thank you, Cookie. This is Melissa. I definitely agree. Back then, when I was a school counselor, I also received therapy at the same time when I was practicing. And I did feel like at the time, like you said, it made me a better therapist because I could have that space to unpack all of my feelings. And at the same time, some of the things that I would pick up from my therapist, I would actually apply to the practice with my students. So it was a really nice thing and so important to have that space. Now I'm curious, Do you disclose with your clients or with your students that you are also in therapy, or how do you set that boundary?
This is Jerome. In regards to divulging that information to my patients, I work at two different facilities, Sinai Chicago and also a private practice deaf counseling center. Um, Often I do notice that it is important to give a little bit of superficial information to show that you can empathize or understand. There's a lot of camaraderie between the two of us. You know, some patients have a really hard time coming to a therapist, and it truly is normal. There are very many people who go to therapists for professionals, and they need to feel like they're not the only one. For so long, deaf people feel so isolated in so many situations, and that's not entirely the case.
This is Melissa. Right, exactly. Yep. Leesa.
And this is Leesa. For their own purpose and for their own benefit, and not for my own benefit, definitely. That's really important to the ethics. So I do divulge that I do take medication. I do see a therapist because I have to also help myself. I cannot help myself if I don't provide the best service as well for my clients. So it's really important for me to take care of myself. So I will share information about self-care, and I do think that that's appropriate for me to divulge that information.
This is Melissa, definitely. Cookie. This is Cookie. I do disclose all that information to my students, and I do that because I want to really dismantle mental health and therapy, destigmatize mental health and therapy, and also in general, I just want to make it okay to have treatment and therapy. So I do disclose that with my students so they can see that I'm doing it too, that I'm human and I'm getting therapy, I'm getting services, and then I can relate better with the students because they understand and I understand where they're coming from. So yes, I do.
And this is Jerome. Oftentimes, there are a lot of people in the deaf community who assume that therapists are like robots, that we have no feelings, that we are perfect and we are greater than thou. And that's not the case at all. We are an equal. Just like Cookie mentioned, that we are human. We do have our own struggles. We have our own feelings, thoughts, and frustrations, hurdles. And it's really important for us to be able to understand that we are all one and the same. At the same time, as a professional, we have to remember that there are boundaries because therapy is truly about them, not you as the therapist. So being able to disclose that information can be very helpful, but in turn can be dangerous. So you have to be very mindful.
This is Melissa for sure. Definitely you have to have that level of empathy with your clients and your patients and the students as well, so they know that you do it too and you really understand what they feel like. You understand their struggles. You're not superheroes. I mean, I think therapists are, but they understand that we have feelings and we have our own life journey. And of course, being in therapy should be the norm for everyone, really.
Absolutely.
So let me ask you, what is the biggest pro that you get from a therapist? What's the biggest benefit that you get from a therapist as a therapist?
This is Leesa, and being in the hot seat, that is where I can see what my client is feeling. I can understand what it's like to also be in a hot seat. It helps me self-analyze a little bit better as a person, as a professional, as a lover, as whatever the issues that you want to work on. It really is important that we know that we're not alone, just like one of you had mentioned. That is very important to remember why we are here and what we're here for.
This is Melissa. Yes. Does anyone want to add anything? Cookie? Yeah, this is Cookie. I wanted to add that being in therapy, as I mentioned before, it really helps me become a better person, but also It helps me, just like Leesa just mentioned, discover things and have that empathy, a better understanding. You learn so many different skills in therapy, really. It's extremely beneficial for yourself, but not only for yourself, but also as humans and as people and as we interact with our clients and just really everyone in general. So you definitely incorporate those new skills, and I think it's amazing to get that different perspective.
This is Jerome. I completely agree. Um, when I started going into the therapy room, it's almost like you can take that hat off, that role off, and the burden is lifted. And you can tell any story that you have to tell, any struggle, and what's happening at work or your personal life. And just like you both have mentioned, Leesa and Cookie, you can learn how to be a better person, learn how to interact with individuals better, personally and professionally. And also, like Leesa, you mentioned, being in that hot seat, more often than not, we forget what it's like to be a patient. If you're working for 40 hours a day and we're constantly being the therapist, we sometimes forget what our clients may be feeling. So often we tell them things that they don't like to hear, but they need to hear. And being able to put ourselves in their shoes for that moment, it allows us to self-analyze and unpack that information, and it changes our skill set and improves me as a person.
This is Leesa. I wanted to add something to that point. I was just thinking, I remember I used to work with a deaf therapist, and now I work with a hearing therapist, and really the intention was to change my perspective in this world, you know? We can't just choose one or the other. And what's really important is when you're shopping for a therapist, you need to find one that really fits you, regardless of whether they're deaf or hearing. And of course, the number of deaf therapists really needs to increase for cultural purposes. But being in the hot seat, I learn from their perspective, and that really helps me to connect with my deaf clients better in this non-signing world.
This is Melissa. I for sure, and I really like what Jerome said. Being a therapist is actual practicing what we preach. We were preaching so often, and you turn around and have that preached to you. It gives you a perspective that when the perspective of being in therapy. Now I have a little bit of a personal question. What is the biggest stigma that you receive from the community or people out there when you disclose, yes, that you are in therapy or maybe that you're on medication? What stigma have you guys experienced?
This is Leesa. People saying I don't need therapists, that I'm fine, I'm completely normal. It's not about who's more crazy. It's not about even what, if you have any mental health issues. The thing is, you don't have to have any mental health issues to receive therapy. You go to therapy so you can unpack, and that's it. You don't have to have any mental health disorders or issues to go to therapy.
Go ahead, Jerome. And this is Jerome. It's really interesting because I am a male. Oftentimes males say, you go to therapy? You're weak. No. It's the exact opposite. When I go to therapy, I'm a stronger individual. Because society has this perspective and expectation of a male.
For sure.
But I'm able to disclose that information, and it shows them that it is truly okay, regardless of genders, identities. It really does not matter. It is a safe space for you to just be you.
This is Cookie. I wanted to add that some people will say, oh, you're a therapist, you should know already. And yes, I've been trained, and yes, I have some experience, but again, as I mentioned before, we're humans first. we're humans first. And in my case, I'm human. I'm a single mom. I work full time. And the list goes on and on. So how can a person manage all of that without support? So additional support is really beneficial. It's extremely beneficial, especially for me. So in therapy, I start learning about my life and start thinking about all the things that I'm doing, thinking about what the balance looks like. And I grow, I learn, I become a better person. And when I'm a better person, I become a better mother. And I become a better therapist for my students. And I become a better person in general. There's so many things, so many different aspects that go along with that. So when I disclose the fact that, yes, I am in therapy and I receive therapy, but I explain it's because it makes me a better person and I learn. And so those are things we have to understand. We're human. We're human first.
And this is Melissa. Number one thing, we are human. We are not robots. And I love that we are emphasizing the importance of going to therapy as part of our regular life. Don't wait for something to happen. Don't wait for chaos to happen, for controversy. We should be proactive. And I know they say preventative health care, and it really should be standardized with mental health. It should be one and the same.
I agree. It's just like a doctor that you're going to go, this is Leesa. So if you have some aches and pains, you're going to go see the doctor. It's the same as mental health.
This is Melissa. Absolutely. I see one good question here from the audience. Are you guys as therapists providing therapy? Do you have to have some specific type of training to be a therapist to therapists?
This is Leesa. Do I provide therapy to other therapists?
Yes.
So you're asking if I have to have special training? I've gone to graduate school. You have to take a licensure test. You have to have insurance. Um, you have to be in practice. But giving therapy to another person who is a therapist just like me is no different than anybody else. It would be the same.
This is Cookie speaking. I work in a school setting, so my training is specifically for students that are in school. That is my specialty, and that's the specific training that I have received in comparison to adults. If I want to work with adults, then like Leesa mentioned, I will go take a test and get the training. But I truly get students. Yes. My little ones.
Oh, I enjoy that. That's cool. I just had a relationship with one of his former kids, Jarom.
And it's been so time. I am like a social worker and I'm going to get some changes and also one thing that I have noticed that is very important is I have trouble understanding and internalize that I'm in the same position. So saying somebody a therapist that has the experience that so I can internalize that I have to work with that person that we both have the same training and special skills. This is
ACT, accept what happened in the past, accept what happened presently, and accept what is coming next. So it's ACT, and all therapists and all sessions do approach the past, future, and present in all sessions. DPT does that as well as MI, motivational interview. That's another type of treatment approach. It's called MI. And what that does is to encourage and invoke change and encourage motivation to happen within the person. So I could definitely identify what my therapist is using, what approach. And I haven't gone to them and said, this is what I want to use or this is what I'd like to do. I just go with the flow. I'm not going to tell them what to do or scold another doctor. You know, a doctor wouldn't do that to another doctor. You have to trust their professional opinion because they're a professional as well.
And this is Jarom. With my therapies, there's been different approaches that have been used, and we bounce back and forth, and which is what I like about this therapist is they don't stick with one method. For example, they'll use the CBT approach and then motivational interview, or sometimes both, or use 2 or 3 in the same session. And the important part is that we're getting information out and processing. So that is the challenge.
This is Melissa. Thank you for sharing. There's 2 questions left before we wrap up. The first one is, do you have a professional support group where you get together with other therapists? I'm sure it's a unique experience for a therapist to also be in therapy. So, is there a special group where you can get together and support each other? And if there's not, what are your hopes, or do you hope to have one?
This is Leesa. Yes, absolutely. On Facebook, there's deaf professional social work or counselors. I am not a Facebook person. I much prefer um, a unique site with all therapists coming together, or signed therapy, or deaf, or coda. It's just important to me to use ASL in therapy and do that online, and to have some kind of Zoom meeting and have those conversations. I would love to share that information. However, there isn't quite anybody out there. I do understand that agencies are usually on their own and work independently, but it would be great if we could figure out how to collaborate somehow.
This is Melissa. Yes, I 100% agree that mental health agencies should collaborate with each other. There's no question about that. Yes, Jerome.
And this is Jerome. I definitely agree with Leesa.
This is Cookie. I wanted to talk about the 2 groups that I'm involved with, and it is amazing all the therapists out there and everyone who's collaborating, which I think is such an important thing. So the first group that I'm involved with is deaf school counselors. It's a bunch of counselors who get together and we can discuss the things that are happening in other schools. And we have a conference every year, something like that. But it's nice to have that support within the school setting. Another group I'm involved with is amazing. I absolutely love it because it is for BIPOC therapists. Oh,
Oh, how nice.
it's
That's amazing.
it is so nice to have that. It's a great experience. It's just it's our own like place where we can learn, even if we have a client that's white and we have a situation that comes up and we try to think about how to approach that, or we talk about systematic changes. And I just love having that type of group, and I feel really comfortable in that group. So those are the 2 groups that I'm involved with.
This is Melissa. Thank you so much for sharing that. And Jerome, and this is Jerome. As speaking about BIPOC, we definitely need more BIPOC therapists. I strongly encourage those who are considering it, please just do it. Go to school, get your license. It truly helps our community. And like Cookie mentioned, that the things that BIPOC individuals, the traumas and challenges that I would never be able to understand, it is so important to recognize. And oftentimes I have conversations with many therapists who feel that they are licensed and they can do any kind of therapies. And that's not the case. That is not the case. Everyone has their own experiences and their own connectivity with their therapist, just like deaf people with deaf therapists. That that understanding of being what it's like to be deaf is one of a kind. And the same concept applies to the BIPOC community.
This is Leesa. I wanted to add LGBT as well in that community.
And this is Melissa. I completely agree. And I truly appreciate you coming onto this public platform and disclosing this information as a therapist in therapy. That's so brave, but at the same time, it proves your true commitment to the field of therapy. You guys are destigmatizing mental health by doing this kind of discussion and having these conversations. So thank you. And I have one last question for you guys, and I think it's a great question to wrap up, and a great way to wrap up this. An audience member asks, so what do you think we can do to destigmatize mental health in our deaf communities?
This is Leesa. Open up the discussion and talk about it. Call things out. If you see someone that's speaking badly or attacking someone who has mental health issues.
And this is Jarom. Continue the dialogue, talk about it. If you hear that there's a certain person who is a therapist, and you may see that or someone that's going to therapy, and you see someone that is looking down on that, try and, if you're someone who looks down on someone who is going to therapy, self-analyze and figure out why you're feeling that way. As Cookie has mentioned and has been mentioned so many times, that we are all human. It's really important to have both of those things.
This is Cookie. I wanted to add that yes, if you feel comfortable disclosing with other people, people that are close to you that you could trust, to talk about mental health, it's really important. So that way people feel like they're not alone, that there's other people like them out there, and they can instantaneously feel connected that way. So it's really nice to create that connection with other people and to talk about it. Just like Leesa mentioned, or I'm sorry, Jerome mentioned, just having that ongoing dialogue with other people is important. So you realize, okay, we're in this together. We're doing this, and you can destigmatize it that way, and you have that mutual understanding. So it's that discussion, that connection with other people.
And this is Lisa. I want to add to that in regards to talking about group therapies. That is another approach. Group therapies, I do not like that so many people say, I don't trust people, or I don't trust them. They're going to tell people outside of the group and outside of the therapies. And I feel like the deaf people, the deaf community, we need to be able to unpack this information. We are deaf first. We are one and the same in humans in being deaf. So how can we help the community heal if we don't have that available to us? So that is definitely something to think about. And I want to provide group therapy, but how do we go about doing so? And it starts with you, reducing that stigma of mental health.
Yes. This is Jerome. It's not only about healing, it's about growth.
Absolutely. Well, this is Melissa. Let this be the very first of more dialogues in our community. And I truly hope that others who are watching this will feel more inspired to disclose some information in regards to themselves. Those who are therapists, will they reach out to each other and help each other? And maybe we can start something with a Zoom meeting. I think that this is so much is coming out of this conversation.
This is Jerome. I wanted to emphasize this as the last statement for this conversation. You are not alone.
Oh, you're absolutely right. And this is Melissa. Thank you so much. I'm grateful for each and every one of you.
Oh, thank you for having us. Thank you.